Good day to all of our viewers, and welcome to our program for this evening. This evening, we want to talk about mental health and psychosocial considerations during the COVID-19 outbreak. Before I start this presentation, I would like to acknowledge and thank Dr. Colleen Bovell, a resident psychiatrist attached to the Georgetown Public Hospital, who would have helped guided and also provided me with some materials in coming up with this presentation. So this evening we want to have a mental health talk. And before we do that, let me just define mental health. According to the World Health Organization, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with normal stresses of life, can work productively, and is able to make a contribution to his or her community. I know for some of us, we don't really talk about mental health so much, or we are not, very au fait with some of our mental health challenges and issues that we or others may go through. Personally, I believe that we need to know more about mental health and its effect on us, just as we are, concerned about our physical health. We must also be concerned about our mental health. And we must be able to talk about stuff and share our views on how things, negatively affect us, and so on. I know in our society, we are not allowed, or we are not granted that, acceptance when we talk about, certain things that affect us. Sometimes we are labeled as being, weak, or, as we might say, carrying too much feelings. Sometimes we hear people saying we need to toughen up and so on. But I believe that we all should be able to talk about stuff that affect us. And, despite of what, many of us sometimes, different things affect different people. And I believe that if something affects you, then you should be able to talk about it and share your views in order to receive help and so on. And so we know COVID-19 has been affecting our society, our world, since December 2019. And during this outbreak, it can trigger, or it can allow us to have mental health problems. And so it is very important that we have a talk and look at some of the considerations in the different groups for this COVID-19. COVID-19 was declared a pandemic by the World Health Organization, meaning that it affects a lot of persons in a lot of countries. During this time, the World Health Organization and other health officials have been working to contain the COVID-19 outbreak. However, during this outbreak, or during a time of crisis like this, it is likely to generate stress throughout our populations. So we are going to look at some considerations on how we can help to reduce some of those stress that we may encounter. These are some considerations developed by the World Health Organization. Generally, for general public, COVID-19 is likely to affect people from many countries and in many geographical locations. So when referring to people with COVID-19, try not to attach the disease to a particular ethnicity or nationality. I know for some of us, we would have heard on the news that this is a China virus, and this is a bat-eating virus and so on. We should not, attach a disease to any ethnicity or any nationality. We should be empathetic with all of those who are affected in our country and also from other countries. We should also remember that people who are affected by COVID-19 have nothing to do, with how it, come about, right? They haven't done anything wrong. They deserve our support and our care, our compassion, and also our kindness. So when referring to, COVID-19, try not to attach a nationality or an ethnicity towards this disease. This can also help in reducing the stigma against persons of different nationalities and ethnicity. Also, try not to refer to people with the disease as COVID-19 cases, victims, or COVID-19 families, even as the disease, right? They are people who have COVID-19. They are people who are being treated for COVID-19. And also they are persons who are recovering from COVID-19. And after they would have recovered from COVID-19, their life will go on with their families, with their job, with their loved ones. It is important to separate a person from having an identity defined by COVID-19 in order to reduce stigma. So we don't want to say that persons are COVID-19 families or cases. Sometimes when persons, or we hear of persons having symptoms or having contracted the disease, we say, I know of John Doe down the street, them family get COVID-19 or he's a COVID-19 case, and we try to stigmatize persons. When referring to people that have COVID-19, we should say, these are people that are being treated for COVID-19. They are people who are recovering from COVID-19, right? Because when COVID-19 is finished or it's cured from them, they will have to go on with their, normal job and life and families and so on. We should try to minimize watching, reading, or listening to news about COVID-19 that cause us to feel anxious and distressed. Seek information only from trusted sources, and mainly so that you can take practical steps to help your plans and to protect yourself and loved ones. Seek information updates at specific time during the day, maybe once or twice, because the sudden or constant stream of news can, bring about panic. It can bring about distress or even worry. We should also try to listen to facts about COVID-19 and its updates from the WHO website, CDC, or even the Public Health Ministry here in Guyana. Try to avoid listening to rumors or misinformation spread by any other agency. These information can cause you to be distressed and can cause you to worry and be also in a state of panic. Generally, we can also protect ourselves and be supportive to others. Assisting others in their time of need can benefit the person receiving the support and also the helper. For example, check up on your loved ones, family, or even friends by telephone. You can call them and ask if they need assistance, extra assistance with anything that they have to do. We can also try to work together as one or as a community to help create a solidarity in addressing COVID-19 together. We should find opportunities to amplify positive and hopeful stories and positive image of local people who have experienced example. For example, stories of people who have recovered or who have supported a loved one and are willing to share their experiences. We know in the news that we have persons that would have recovered from COVID-19. For example, we can share those stories with others so that we can reduce the stress. Also to promote hope in other persons that have contracted COVID-19 or been treated for COVID-19, so that they will know that they also can recover from this disease. We can also help to honor our carers and our essential leaders. Be supportive of them during this time of COVID-19. Maybe in your community, in your family, you might have an essential leader. You can honor them, support them during this time. Acknowledge the role that they play in saving life and in keeping people safe. Some consideration for our essential leaders and healthcare workers. Feeling under pressure is a likely experience for our essential leaders and many of their colleagues at this time. It is quite normal to feel this way in this current situation. Stress and the feelings associated with it are by no means a reflection that you cannot do your job or maybe that you're weak. Managing your mental health and your psychosocial well-being during this time is important as managing your physical health. Our healthcare and essential leaders should take time off for themselves. Try to use helpful coping strategies and ensuring that you have sufficient rest during your work or between your shifts. Eat sufficient and healthy food. You can engage in physical activity and try to stay in contact with your families, with your friends, and with your loved one. Avoid using unhelpful coping strategies such as the use of tobacco, alcohol, or other drugs, because in the long term, these can worsen your mental health and your physical well-being. Our LK workers may unfortunately feel avoided by their family or by the community owing up to stigma or fear. This can make an already challenging situation far more difficult. If possible, stay connected with your loved ones, including through digital methods. It's a way to maintain contact and to reduce this stigma or this fear. Turn to your colleagues also, or your trusted persons, because they may have similar experiences like you. We should all try to support one another during this COVID-19 outbreak. Some considerations for our children. Help children find positive way to express feelings such as fear and sadness. I know sometimes we limit our children in expressing themselves in some communities or in some families. We try to teach our children to be strong or to be tough, and we don't want them to, say certain things. But I believe that we have to find ways and how we can allow children to express themselves in a positive way, so that we know what they're going through and how we can help them. Every child has is their own way of expressing emotion. Sometimes engaging in creative activities such as playing or drawing can facilitate this process. Children feel relief if they express and communicate their feelings in a safe and supportive environment. So we must help our children so that they can express and communicate their feelings during this time. And remember, not every child or every person will express their emotions in the same way. Everybody have different ways in how they would express themselves and how they get things over. But we must allow or provide opportunities so that they can do so. Keep children close to their family or their parents if considered safe, and also avoid separating children from their parents or from their loved ones as much as possible. If a child needs to be separated from his or her primary carer, we should ensure that appropriate alternative care is provided, or that a social worker or an equivalent will be regularly following up with that child. Ensure that during periods of separation, regular contact with parents or carers is maintained, such as twice daily. You can call them, you can have video calls, you can have other age-appropriate communication. Maintain family routines that you would have previously um, prior to COVID-19. You should try to maintain these routine as much as possible, or create new routines, especially if a child is at home. Provide engaging, age appropriate activities for your children, including activities for their learning. Where possible, encourage your child to continue to play and to socialize with others, even if only within the family, when advised to restrict social contact. During this time of stress and crisis, it is common for children to seek more attachment and be more demanding on their parents. We should discuss COVID-19 with, our children in an honest and age-appropriate way. If your children have concern, we should address them together. This may ease their anxiety. Children will observe adults, right? They will observe your behavior and your emotions, and they will take example from you, and they will learn from you how to manage their own emotions during difficult time. So it is very important as parents or adults that we, steer the way, or we always try to show our kids positive way in how we can deal with, stress or COVID-19 at this time. We can also help them by, like I said before, maintaining your routines that you would have previously or prior to COVID-19, which includes, them waking up, them, having a time of, television, then they engage in learning activities, they head to the books, or sometimes they can, draw something or play some games that will help them develop their learning or their reading. Now let's look at some consideration for our older adults or people with underlying health conditions. Older adults, especially in isolation, and those with cognitive decline or dementia, may become more anxious, angry, stressed, agitated, and withdrawn during the outbreak or while in quarantine. We should provide practical and emotional support through informal networks such as families or healthcare professionals. We should also share simple facts about what is going on and give clear information about how to reduce the risk of infection in older people with or without cognitive impairment so that they can understand. We should also repeat certain information when necessary to our older adults. Instructions to them need to be communicated in a clear, concise, respectful, and patient way. It may also be helpful for information to be displayed in writing or in pictures if necessary. We can also engage family members and other supportive networks in providing information and helping people to practice prevention measures, include hand washing, social distancing, wearing a face mask, and so on. We can provide or help our older adults to understand these preventative measures more appropriately. If you have a underlying health condition, make sure to have access to any medication that you are currently using. Activate your social contacts to provide you with assistance if needed. You should also be prepared and know in advance where and how to get practical help if needed, like calling a taxi or having food delivered to you or requesting medical care. Make sure you have up to 2 weeks of all of your regular medication that you may require. Learn simple daily physical exercise to perform at home, in quarantine or in isolation so that you can maintain mobility and reduce boredom. You can also keep regular routines and schedules as much as possible, or help create new ones in a new environment, including regular exercising, cleaning, doing your daily chores, singing, painting, or any other activity. Keep in regular contact with your loved ones via your telephone, social media, email, or any other means you may have. Some consideration for people in isolation. We should try to stay connected with those persons and to maintain, like I've been saying, to maintain social networks with them. Try as much as possible to keep your personal routine or create new ones if circumstances change. If you are in quarantine or you are in isolation, self-isolation at home, you should try to, create daily activities so that you would reduce boredom and reduce your anxiety. Also, when staying at home or staying in isolation or staying in quarantine, we may have times of being stressed or being anxious. During these times, it is important that we pay attention to our own needs and our feelings, and we should engage in healthy activities that you find enjoyable or that you find relaxing, such as regular exercise, keep regular sleep routines, eat healthy foods, keep things in perspective, and to know that our public health agencies or our essential workers and leaders are working daily to ensure that we have the best care available to us. Also, in our self-isolation or quarantine, when listening or constant listening to news, this can provoke stress or anxiety in us. And it is important that we seek information from our trusted sources, as mentioned before, such as the WHO website, CDC, or the Ministry of Public Health here in Guyana. We should try to have a time of the day, a specific time of the day in which we view these information. Try not to read or to view these information regularly, because these can cause you to have anxiety or to be stressed. We should also try to not listen to rumors and misinformation about COVID-19. This can make you feel uncomfortable, and also we should try to or limit our sharing of certain information. We should always try to share positive information about COVID-19, such as persons that would have recovered to COVID-19 or persons that are helping other persons in providing care or in providing support or any type of service during this time. This can promote, positive feelings of hope in other persons of COVID-19. And remember to stay safe and to protect your mental health as much as you protect your physical health.